listening to The Doctor's Corner with Dr. Kline and Janelle Elgaway.
Good evening and welcome to the Doctor's Corner with Dr. Kline. I'm your host, Janelle Elgaway. If you have questions or comments for Dr. Kline, please call in at 415-915-2291. You can also live chat with the audience on KAW's YouTube channel, Conspiracies Against Wellness live stream. And don't forget, tomorrow, guest Victoria San will join KAW Nation at 8/7 Central to discuss her new full-length feature film called Becoming Incurable. It's about 3 different people with rare and painful diseases and the difficult issues they face living with their disease. And now for tonight's show, The Doctor's Corner. Welcome, Dr. Kline. How are you this evening?
I'm just fine, Janelle.
Good. So tonight we were going to discuss some of the newer things that are going on within the CDC, the CMS, concerning pain medication and people that are in pain. But I wanted to focus a little bit on fentanyl. Can you talk about what exactly is fentanyl and what is the current problem with that we are all facing?
Fentanyl is a narcotic. It's man-made, however. It's not from the opium plant, like morphine and diamorphine, which is heroin, and oxycodone and codeine. Those are all from the opium plant.
Okay.
Fentanyl is actually just made in the lab to mimic the effects of opiates, and it does. It's been around since 1968. For us in the medical profession, it's a wonderful drug. It's used in anesthesia. It's used in babies who are being operated on. It's being used by veterinarians because it comes in a film that can be put in the animal's mouth. It can be used intranasally, IV, orally. It's a really good medical product. Now, a lot of times good medical products end up on the streets. That was the story of diamorphine, which was a partially chemically made derivative of morphine to try to have less side effects from morphine. So diamorphine was an excellent drug that we had. Okay. It has the trade name heroin.
Right.
Now, heroin is really just... Go ahead.
Oh, no, go ahead.
Heroin is just another pain pill, but it was made illegal in 1924 by the federal government, thinking they could control the supply, control addiction, and control vice that came from the addiction. Fentanyl is the same thing. The drug cartels and drug suppliers feeding the American market, which is the largest in the world for all illicit drugs, is now being used on the street.
We actually have a caller, if you don't mind if we take it already.
Okay.
Caller from area code 847. What's your name and where are you from?
Hi, my name is Kathleen McGill. I'm from Arlington Heights, Illinois.
Hi, Kathleen. How are you?
Good evening.
I'm good. How are you? Hi.
Good.
Hi, doctor. Thank you so much for taking the call. I was curious about how many suicides there has been since the CDC's regulations have come out, and if you could maybe talk about that, of chronic pain patients, because I have a hard time finding any statistics on that.
There are no statistics. The CDC was required by the Scientific Advisory Board, sort of their boss, to be sure to follow up on their guidelines to make sure there were no untoward effects of the guidelines. They've never done that. I've not read anything. Maybe it's being prepared behind the scenes. I do know the VA is looking into suicides from people being cut off, but nobody's officially doing it. So a group of us started to try to collect stories to memorialize people who have been forced off their medicine by the government. And we have a small list of people, about 30, but we have no idea how many more there are. A lot of families didn't want their loved ones publicized. You can understand that. All of the suicides we list are either by or by violent means. People who try to commit suicide by stashing their medicines, a very common procedure amongst people with chronic pain. They stash away some medicine for the day that they're cut off, and then they can end their lives by taking excess pain medicine. But none of our group had those because they were all cut off. So when a person does take their pain medicine and ends their life, guess what the coroner says they died from?
What's that?
Overdose.
Mm-hmm.
So then they get listed with people with addiction disease dying of overdose. There are ways to tell, and you have to have good medical examiners. Those are doctors like me who are pathologists, who study the crime scene, who don't rely just on death certificates. They're very, very inaccurate. Get the charts out if they've been sick, do a regular investigation, interview people, and then come up with a determination. And that way we would start to know. But right now it's being hidden, maybe not on purpose, by county coroners. Oh, he has a tattoo. Oh, look, there's a needle. Oh, look, he had prescription bottles. Overdose. Then it gets racked up and talked about. So it's really a terrible thing because I suspect there are a lot of people committing suicide simply from a human standpoint. If I had to put up with constant, horrible, daily pain that I knew could be simply relieved by a safe and effective medication that was taken away from me, and now I have no prospect of ever getting that relief back, I can understand it.
Yes, sir. I talk to people every day that are like that, and have had friends that have committed suicide because of that. And I've been in dark places where that seemed like the answer. And now I was also curious if you could answer a question for me about the CDC inflating their statistics as far as the opioid deaths. What can we do about that? Because it seems like that's being pushed right under the carpet.
They kind of got caught with their pants down.
Mm-hmm.
They've cut the prescription drug deaths in half, from 33 to 17,000. It was published in an obscure journal that if you go online and try to get the article, they want $35. You have to go down to the library through interlibrary loan to even get a copy of the drug study, but I have it. And one of the authors was one of the 3 authors of the CDC guidelines. So it starts to look like a little mea culpa is coming out of the CDC. All I can tell you is the CDC guidelines were not based on fact.
And yet they're being cited by the president and, everyone who discusses this war on opioids, and they're incorrect.
Well, you are correct, and everybody was talking about the attack on the ships in the Gulf of Tonkin in 1964 by the commies, and we passed a resolution in Congress called the Gulf of Tonkin Resolution, in which we started the war in Vietnam in 1964. And it was a lie. There was no attack on the naval vessels. It was a lie. And the CDC is promulgating lies. But it becomes a convenient story to fit the American hatred, venomous hatred for addicted people and dope fiends and dopers, going way back to 1915. So it becomes a convenient, let's start quoting this, 4 times the numbers that there were, more deaths than there were car accidents. Of course, car accidents are decreasing. So I consider this as a physician and as a person trained in research to be dishonest. I think the CDC is dishonest, and I think they should be held responsible for all the people who have committed suicide by forcibly taking away their pain medicines. Now, the CDC will say, oh, we didn't take anybody's medicine away. But that's kind of the same argument as when you flick a cigarette butt out the window and it starts a forest fire. Oh, we didn't mean to. You know, you're still responsible. Back to the pain issues and what you can do. You need to let people know just what you just said a few minutes ago. And you need to call TV stations. They're becoming more interested now in 1 or 2 cases or 3 or 4 cases if you have friends, you know, to sit down and be interviewed and tell your story. What you just said to me is a very powerful thing. You know people, you've had this yourself. It's so bad that people are considering ending their lives because of forced removal of medical treatment.
Mm-hmm.
I mean, this is just unimaginable. So,
did you have any other questions?
Mm-hmm. May I ask one more question? Is that okay?
Go for it.
You had said that you do have a copy. I'm sorry. But you had mentioned that you had a copy of the actual numbers as far as the statistics with the opioid deaths. Is it possible to publish those, or is that not possible?
Well, we have a list of people that we've gotten together from many sources, and you can Google it by using these 3 words. You Google the word medium, suicides, Kline, Kline, and that will take you to the list that I posted on Medium. It's not just my list. Lots of people, put input into it. I just kind of collated it all.
Yes, sir. I actually have posted that list, and I want to thank you so much because no one else did anything. So I thank you very much, and I thank you for taking my questions.
Thank you, Kathleen.
All right,
appreciate
nice
it.
Talking to you.
Sure. Bye-bye.
So the original problem may have been from the abuse of prescription pain medication, and then it changed to heroin and now illicit fentanyl. Why hasn't the government or media picked up on this? Fentanyl is shipped over from Mexico and China, and it goes undetected because of the size and there's no smell. This is a major, major problem. Why aren't they talking about this? I mean, this is a possible solution here. What do you think about that?
Well, fentanyl is easy to make, easy to smuggle. The DEA is on it.
Mm-hmm.
They did round up some people in Utah who made 300,000 fake Vicodin tablets, one of which ended up helping to kill Prince.
Right.
So they're on it. But the problem is you can always develop an offense faster than you can a defense. Mm. So in other words, when the drug cartels come into the field, bringing in all the illegal stuff, finding routes to come in, the DEA has to play defense and try to catch up and catch them when it comes across the borders. And it's just impossible. The DEA has only intercepted 5% of the illegal drugs. That's not zero. That's helping. I spoke with a person who has addiction disease, which nobody seems to speak with. And this person said that it's getting harder and harder to find retail people selling heroin because the fentanyl has now taken over the market.
Wow.
So you see, we're still behind. We don't realize that heroin is liable to not be a problem anymore because fentanyl is easier to use. Mm-hmm. It's an ideal anesthetic, so it makes it a little safer for the people on the street to use it. Hard to say that, but also it's a little easier to figure the milligrams. With heroin, it's impossible. You get this white powder to figure out how many milligrams you're getting. So a lot of people die from accidental miscalculation of the dose. And then people turn around and say, well, they shouldn't be taking it anyway. Well, come on now. This has been around for 100 years. It's a real disease. And we need to stop treating it as a criminal activity and deal with it. There is a little test strip I saw in some article for fentanyl. How come these are not on the streets?
Right.
How come people can't test their own fentanyl? How come addicted people can't take their fentanyl and get it tested. Oh my goodness! If we did that, there would be more addiction.
Right. Well, and they're doing that with Narcan. I mean, if they're going to have Narcan there, I saw an article saying that they would like to have anybody that has an opioid prescription. They want to start having you also have a prescription for one thing of Narcan. So, but if they're going to allow that, I mean, go ahead.
That's pretty ignorant.
Yeah. Exactly.
And it's also a waste of money. This, they're about $100 each. There really are no significant overdoses for people already on opiate pain medicine. This just doesn't happen.
Well, and if you look in other countries,
there are no good.
Go ahead.
Yeah, in other countries, heroin addicts in Vietnam didn't overdose because they knew how much they were taking.
Right.
So giving people Narcan gives them the message that, hey, you're taking something really dangerous you could die from. And so now they got this horrible pain, and now they're worried about they're going to die from their pain medicine.
Right.
That's kind of cruel.
Well, and the thing is,
it's kind of a waste of money.
Oh, of course. Well, and the thing is the people that are the patients that are taking opioids for medical reasons, they're not the ones that you have to worry about with this. I mean, they're not the ones that are going to be overdosing. They're not to have issues, with this. I mean, this is substance abuse users, correct? I mean, so why are we being pulled?
Yeah, Narcan is.
Go ahead. Oh, no, just why are we being pulled in?
Is given to police.
Yeah.
Well, Narcan is given to police departments, and it should be given to more street-addicted people, but it's not because there's no public health initiative. They're going to spend $5 billion this year, and there's no public health initiative. Public health initiative would be public health nurses go out and they visit people in the community with addiction disease, just like they visited gay people to teach them about using condoms and not getting HIV, and just like they went to the schools and talked to the young women about, pregnancy issues and contraception. Well, they need to go out and talk to people with addiction disease, right. The addiction community. They're all out there hiding. Do you think they go to doctors? Why, they're all criminals. Well, nobody's going to insure them. I mean, they have health problems. They get pneumonia, get sick like everybody else. And there's no medical care at all for the million or so people in this country that have addiction disease. So we should at least send out some public health nurses and say, hey, here's some Narcan, and by the way, an Ambu bag and mask that you can use to resuscitate somebody who stopped breathing, $20 on Amazon.
And
how come they aren't? How come we aren't out teaching, buddy system? Never shoot up alone. Oh, but we can't do that because, as Henry Anslinger, the great dope chief, said in the 1930s, don't teach people about narcotics or else they'll just take them.
Yeah. I have some questions this week. Somebody asked me why, if there is more pain patients or patients that are on opioids and stuff like that, if there's more of them than there are addicts, why are they so focused on the addiction side? Why aren't they more focused on, the patients?
It goes way back to how you figure out somebody's a witch. Right. So what they did is they developed these criteria for the witches, special moles that they had when their dog started to act funny. So they would develop these characteristics. So anybody that had these characteristics was a witch. And so they hanged 20 of their neighbors because they had these characteristics. So what is the characteristic of a dope fiend? A person who takes opiates. Therefore, if 10 million people take opiates, sooner or later they're going to be dope fiends. That's the logic that's being used. And because it feeds into the great American fear of pain medicines and opiates and narcotics and dope fiends and crime and licentiousness, it's a perfect salve for the moralists. So that's why it's totally non-medical. It's against the United Nations right to treat pain. It's a violation of human rights. It's a violation of common decency to label 10 million people as having addiction disease. In Canada, your doctors can treat addiction disease. Here, I would be arrested. So somebody comes to the office and they say, you know, I got this pain all over, doc. Can I have some more medicine? So the doctor closes the door and says, you know what? Kind of sounds like maybe you have addiction disease. And what do you think? You know, you're not going to be arrested. We can just treat you. Here, I'm going to write you a prescription, and we're going to treat your addiction disease. The next 10 people that come into the office, all looking nervous because, my God, please don't stop this stuff. The Canadian doctors say, okay, you have pain. I'm going to treat you with this pain medicine. And that's not to say there aren't problems in Canada, but overall, doctors don't need DEA licenses. Doctors are considered smart enough to be able to handle and prescribe any medicine. All of a sudden in the United States, we're all idiots, and we're making these terrible mistakes just on pain medicine. Just on this one drug.
We have a question from YouTube. Lovett says, Dr. Kline, in my calls to TV stations, media, they can't get any interest. Suggestions?
You got to pitch them. It's called a pitch. You have to present a case, like being a salesman or saleswoman. You may be pitching it wrong. Try to pitch it from the standpoint of suicides and of thinking about suicides and suicide planning, or pitch it from the standpoint of several people having this same problem, or try to think of a new way. I mean, I can't think of it right now, but that's the whole idea of a pitch, is to think of a new way to sell the vacuum cleaner. You know, I mean, I could go around and say, hey, this thing sucks up dirt. Or if I was real clever, I could say, you know, dirt causes disease, and this vacuum cleaner is going to make you all healthier. You know, so it's that kind of, salesmanship. Not all TV stations are going to be interested, so you call their competitors.
Right.
And you can try radio stations, too. There's lots of radio stations, and it's hit or miss. You're going to, you know, some editors and producers don't like the idea of this. They may think, you know, that this is all a bunch of nonsense. Everybody's really a dope addict, and so don't bother me.
Right. You know, fentanyl, it's showing up in the street drugs now. It's showing up in meth, heroin, cocaine, everything. And it's essentially such a lethal poison. And that's what this is. It's a poison that even Narcan isn't working on the newer forms of the fentanyl. Why doesn't the government just stop all imports and exports from these countries like Mexico and China until they deal with this drug crisis? And I'm talking about until China and Mexico deal with it. Why are we allowing this in?
Well, this being smuggled in, and the DEA is trying their best. I mean, they're very aware of this. And, you know, smuggling is easy. Fentanyl now it's such a small amount, you know, that you can put it in a little baggie and have enough, you know, for multiple sales over a month. So it's very easy to smuggle. You cannot stop smuggling.
Mm-hmm.
You have to stop, as one Colombian drug lord said when they interviewed him. And how come you're having so much cocaine? You're growing so much cocaine down here. He says, well, you need to talk to the American people about demand.
Right.
Why is there demand for fentanyl and heroin? The reason there's demand is because heroin addicts are arrested, and the opiates that they need for their addiction disease are illegal.
Right.
So if you want to make a drug and a disease illegal, guess what? You're going to have a black market, and you're never going to defeat it, ever.
Wow.
So it sounds like a good plan, but it isn't going to work.
Yeah, no, you're right. You know, we can't do much about the past, but we can do something about the future. I want to talk a little bit about solutions because, especially coming up, I know there's going to be a lot of people going to rallies and stuff like that, and they're going to be speaking. And in there, you always, if you're going to be speaking, or if you go to your, governor or senator or congressman, you know, you always want to lay out the problem and then give some solutions. So, what are some solutions that we can talk about? I know we talked about also like the DEA. What are the possible solutions with the DEA to kind of fix the problems concerning this?
Well, one thing is people can actually help out the DEA by providing them with tips. If you see fentanyl activity in the area, or you even hear about it, people don't understand that police departments work off tips. A tip is something where you're suspicious and you call the police department, local or state police or federal police, and you say, look, I just have this tip. Now, the good police departments aren't going to blame you if it's wrong.
Okay.
They're not going to say, that you're not going to report you to the criminals. This is how investigations work. So the DEA can do its job in trying to take hold of this problem with the fentanyl, which is very serious. So if you hear that some kid, they're talking about fentanyl at the high school, you call the police department. You can call the local police department and they'll contact the DEA. But they work on these tips because the police driving around in cars, if nobody's telling them anything, they're not going to be able to divine that there's crime going on. Mm-hmm. So that's very important. On the other side of the DEA, they need to stop arresting doctors for federal drug charges that were reserved for drug lords.
Right.
There should be a cap on the amount of money involved, like $5 million, before they institute these laws. Doctors are being arrested now on conspiracy charges. Mm-hmm. If one of their patients goes out and sells the medicine, they're considered guilty. So that needs to be fixed. The CDC needs to come out and say, I'm sorry, we started all this. Here are the reasons you should use prescription pain medicine. Nobody ever talks about that. They always talk about like there's no indication, our word for use. There's no use for pain medicines. Good Lord, where have they been? You talk about putting your head in the sand. CMS or Medicare can help out by giving doctors a little more leeway in working up a palliative care certificate. A palliative care certificate exempts people from any kind of controls on the amount of pain medicine they get. It protects the doctor. CDC guidelines in their very first sentence says their guidelines are exempt for people with palliative care. Most every single state has exemption for palliative care, protecting both the doctor and the patient. You can receive as much as you need.
Why aren't they using that?
So what is palliative care?
Yeah.
I don't know. This is more head in the sand.
Okay.
Palliative care is having a disease that has no cure. Okay. Practically every patient I talk to on Twitter has a disease that has no cure.
Right.
Secondly, it's a disease with serious disabling symptoms. Could be pain. Some people have intractable vomiting. Some people have intractable diarrhea, like with colitis. Mm. Some people have intractable coughing. All of those are symptoms, and we can treat symptoms and bill for them. You don't have to have a diagnosis to bill Medicare or insurance companies. So you've got to have a disease that's incurable. You've got to have symptoms that can be treated. And thirdly, because of the old carryover from hospice, it could potentially shorten lifespan. Mm-hmm. So anybody that sits around in pain all the time, not getting exercise, could potentially have a shortening of their lifespan. Those are the three criteria.
Is there a list that talks about what diseases or what painful diseases or rare diseases that are out there of what's on there? Because I know, for example, pancreatitis disease, it's not on there. How do we get a list that would be good? Because I know you said those three. Mm-hmm.
You don't need a list,
right?
It has this determination of palliative care status has to be done by a licensed medical professional, doctor, nurse practitioner, or a physician assistant.
Okay.
We have the licenses to determine what diagnoses are. Nobody else does. So we determine their diagnosis as palliative care by using those three criteria, it makes no difference what the underlying disease is.
Okay.
All you do is determine this disease is untreatable, and has a symptom that needs relief, which will improve everyday life. So it could be any disease. I can't think of very many diseases that people have that have long-term pain that are not palliative care.
Right.
I just published a little article on palliative care to explain what it is, and also a certificate that can be filled out by the doctor. And the article discusses how physicians can bill more time, because a lot of physicians don't want rare disease and painful disease because there's so much time involved. I spent 45 minutes today on the phone with the insurance company trying to get pain medicines for my patients. A lot of physicians are saying, yeah, well, I would prescribe before, but I'm not going to anymore. I mean, I can't take 45 minutes a day for 6 patients, so multiply 45 times 6, and spend all day on the telephone because insurance companies are screwing people and keeping the money. All given permission or license, let's say, by the CDC, making up things that are not true, that are not factual. And I've read those things very carefully. So anyway, if anybody's interested, I mean, I'm not really selling jellies and jams. I mean, I put out stuff for people to use. It's free. And you can also Google medium palliative care CONCIA, CONCIA. Medium palliative care CONCIA, CONCIA. She's a nurse practitioner who practices palliative care in Oregon, and she and I wrote this paper together, one from a doctor standpoint, one from a nurse practitioner standpoint. And it's something you can share with your doctor. Do not go into an appointment and say, here, doctor, read this. What you do is you make a copy of it and you send it in the mail to the doctor to read ahead of time. Okay. Doctors do not like patients bringing stuff and putting it on their desk. It's just one of our bad traits. I mean, why should people worry? But it is. It's one of our. We grow up that way, you know. So send it ahead, and there's also a certificate that you can download, a PDF certificate that was designed by a research assistant of mine, David Williams in Goldsboro. He designed the certificate. He's also a pain patient. And so we have kind of everybody chipping in on this thing. Palliative care would solve the problem.
Right.
But you know what? We're already getting feedback from doctors. That's just another excuse to get more narcotics. Well, and when doctors say that, you say, you know what? I'm going to find another doctor. Of course, it's getting pretty hard. But if physicians read this paper, they'll realize that the government, at least Medicare, has provided a way for doctors to bill for the extra time.
Right.
I mean, I don't have an electronic medical record, so I don't qualify.
Well,
that 45 minutes I spent on the phone could be actually billed for.
I was going to ask about coding a little bit, too. Is there a lot of problems with coding? Is that why they don't do it, too? I mean, is it easy to see?
I don't. Yeah. I put that in the article. Basically, you can code for chronic disease.
Okay.
And there's like 4 codes. Chronic pain. There's chronic pain codes. They're payable. And so you just bill for the chronic pain. You don't have to worry about lots of other codes and things.
Okay.
And, I checked with Medicare, by the way, and they said it's fine. Any code that's, reasonable is going to be paid for. If they reject the claim, you can call them up and say, what's the story here? And then you can add the underlying disease code if you want, but you only need the symptom code because palliative care is relieving pain and suffering.
Right.
So what is pain and suffering? It's pain and suffering. It's real simple,
Right.
And you take care of it. You have to suppress coughing or suppress diarrhea or suppress pain. You do it, and you can bill for just that.
Okay. I just want to remind our audience, too, if you would like to call in with any questions, you can at 415-915-3275. 2291 or call 1 like CAW 1. So, okay, recently CMS has come out that they are now suggesting a cap. Instead of the 90 MME, it's 200 MME. What do you think about this?
Well, CMS, by the way, is Medicare Medicaid Administration.
Mm-hmm.
The FDA is the only agency that has regulatory authority over prescription drugs. They're the only agency with rulemaking authority. If CMS or Medicare wants to set new limits on the use of a prescription drug, they need to go to the FDA and get approval.
Okay.
They can't do that by themselves.
So this coming out isn't really a new law or rule. It's just a suggestion, maybe?
It's not a new, it's a proposal rule. It's still in the proposal, and it's not going to fly because pretty soon people are going to catch on that the FDA is really in charge, and FDA currently has no upper limit on opiates. Very unusual drug category. Well, no other drug categories like that.
Okay, but what about with the CDC making these guidelines, and they were just guidelines? Why did everybody just jump on it? Because the FDA said there's no difference between, cancer pain and chronic pain, and then you have, you see all these doctors suddenly trying to get below the 90 MME or 90 MME. Why did they jump on that when the FDA didn't approve that? Did they?
No, they certainly didn't. And here's the reason. We've always thought the most scientific, trustworthy agency was the CDC because they're the ones who track epidemics, right? Real epidemics of Zika virus, influenza, whatever. So we've always trusted them. But they lied to us.
Right.
And I'm not going to ever trust anything that comes out of CDC. And there's been complaints from the CDC scientists to Congress that there's too much politics in the CDC. They want to just be scientists. The new director of the CDC is from my alma mater, Maryland.
Okay.
He's a researcher in HIV, very respected man. He's had some, experience in government, and hopefully he will start to turn things around. He stated that he's interested in science, and he's interested in getting the facts. This is what we always thought of with the CDC. How they veered off into the opiates is another story, and it has to do with the Physicians for Responsible Opioid Prescribing, or PROP, who are basically lunatic fringe people who believe that, a pain is it's really nothing. You can just will it away or take some Tai Chi. And that all pain medicines are really heroin pills. And that really all pain medicines need to be taken off the market because all it does is kill people and cause addiction. This is lunatic fringe.
Stacy Fields
so that's how the CDC veered off.
Okay. Stacy Fields asked from YouTube, do you think that private insurances will follow the 20 or 200 MME that M&M says they will cap it at?
Yes. The insurance company always follows Medicare.
Okay.
And Medicaid, CMS. Yep, they'll just jump right on, and then of course they'll just make it worse.
Right.
Because anytime an insurance company can make money, and then the government gives them a reason to, it's getting to the point where people that need pain medicine aren't going to be able to get any. From their drug companies. Some are requiring now prior authorizations, which is 20 minutes of my time at no charge to solve an insurance company problem and to increase their profits because, you see, they're not going to lower the premiums. They're just going to keep the money. Simple economics. Oh, the CDC said we have this cutoff. And by the way, if you want to read about the CDC cutoff not being a cutoff for chronic pain, you can also go to Medium Houry, Houry, Kline.
Okay.
And it will take you to my Medium page where I discuss what was actually said by the director, Dr. Houry, the day the CDC regulations came out. And if you wait until noon tomorrow, it's going to be expanded to discuss what's actually in the regulations, word for word, along with my choice comments. The CDC never did set a 90-degree cutoff. It was only a suggestion for very first prescriptions.
So why did it go to that?
Just run wild.
Yeah.
It went to that because there's a fear and prejudice in the United States about dope fiends. And this fed right into it. They just jumped on it. Oh, my God. See, that's why we have all these dope fiends. And that's why young kids are dropping dead, because they're on heroin. We have to stop this. And it's time for some rational thinking because we're in a McCarthy-era thinking pattern.
Right.
If your mommy is a commie, then you got to turn around. I was around in the 1950s, and I still remember as a kid this horror of these commies being everywhere. There was talk that some of the teachers at school were communists, and certainly that guy down the street with those dogs, he's definitely a communist. And this is when all the actors and writers got blackballed; they couldn't find work. It's exactly the same. It's exactly the same. It's a national hysteria.
The latest admission from the CDC is that they inflated the number of overdoses. Can you talk about this? Can you talk about this a little bit? And why is it important that we don't let this be swept under the rug? Why is it important that we make sure that they are held accountable for this?
We're taxpayers. We pay for the CDC. We paid those people to write these guidelines. They wrote them out of prejudice. They did not write them out of fact.
Well, they stacked it.
And they admit that themselves.
Right.
Yeah, they say right in the guidelines, there's really no good scientific basis for this. So we just use what they dreamed up, a new word, contextual analysis. What that means is your opinion. And they made this word up, contextual evidentiary analysis. This is just dishonest. And taxpayers are paying these people to be dishonest and ruin their lives.
Isn't there somebody to watch?
5 to 6 million people
right.
Going, well, who watches? It was James Madison. I stood beside his desk in Virginia, and John Adams. They wrote the Constitution and made sure there was checks and balances.
Right.
So what's the check on the executive branch? The CDC, the DEA, all in the executive branch. Congress. You got to go to your Congress people and say the government is interfering with my doctor-patient relationship. And I want it stopped because it's harming me as a patient. It's driving people to suicide, and it's got to stop. Right. And I want you, as a legislator, to figure out how to make it stop. We are providing information, that's also going to be on the medium. You can also, it does sound like I'm selling jellies and jams. It's sort of embarrassing. But if you Google medium refugee Kline, you'll get my paper on the opioid refugee crisis and what to do about it.
Okay.
I'm in the process of revising that, but the one that's in there isn't too bad. Okay. So you go to your congressman and you go to your state congressman, you call up and you say, I want to come in and talk to the legislative aide in charge of health. You don't have to, talk to the Congress. I want to come in there and I want to tell you what's going on. Here's what's going on. And you just start to fight back. We're sitting around defending ourselves saying, but no, that's not the way it works in the United States. You get up and you scream and yell and you go in and you say to your congressman, you are in charge of controlling the executive branch. And that means the DEA, CMS, and the CDC. All of those are under the checks and balances from Congress. Now, Congress is having a hard time because they believe in all this too. So it's a slow process. I mean, I can go before Congress and argue and make these logical arguments. They're not going to listen to me. But your congressman especially congressmen. Senators, represent the whole state. You can talk to them too.
Right.
But your representative, your congressman, is the key person to go talk to because you are in their district.
Right.
And they're interested in making sure that you have the right to redress Congress, ask for redress from Congress. In other words, you have the constitutional right to go before your federal and federal legislatures and say, I need help.
Right.
I need help with this. This is the worst medical care crisis in the history of the United States.
Yes.
Because there are 6 million people being purposely harmed by taking away their medicine and depriving them of medical care. And it needs to stop.
Yeah. What can patients do when they are denied care from their doctors? Should they go ahead and ask for the palliative care what do you call it, a certificate that you have? I mean, where do they go after that? I mean, do they go to the next doctor? I mean, I know you were doing some studies or looking into doing some studies on this. What should they do?
Yeah, there are no more doctors. We're out of doctors.
You're right.
People can't find doctors. So I think the best thing is to have an adult conversation with your doctor.
Okay.
You go in, close the door, and you take your chair and you move it up to the side of the desk. And you say, Doctor, we need to have a face-to-face conversation. What can I do to help you out of this? And what can you do to help me? And, I think that kind of a conversation could be helpful. Some doctors will get insulted, in which case you just leave.
Yeah.
But the ones who will listen to you, I mean, this is the time to maybe send ahead the palliative care article and the palliative care certificate. If physicians read the article, I think they'll start to realize that this can be protection for them because, the state says all these guidelines are null and void if you have palliative care. And palliative care is really a simple diagnosis to make, and only a doctor can make it. And if they fill out this certificate, you can use this, in pharmacies and stuff, and they'll laugh at you. But too bad.
Yeah.
You have palliative care status. And then you've got something more that you can argue with. In other words, you now can go to your congressman and say, look, I have palliative care status, and they're still denying me medicines. See, that's a lot easier than going and saying they're denying me medicines. You have this special status in the law, in the state law, and in the first line of the CDC guideline. It exempts palliative care. So those words are in the law. And that makes a lot more powerful argument than just saying, hey, I think what you're doing is wrong.
Yeah.
So I think palliative care, and that's why Carolyn Gancia and myself wrote this, because we're both clinicians, and Carolyn practices palliative care and also hospice care. And it's even getting to the point that it's so sick they're not even giving dying patients or medicine for fear that they will addict them. See, it's really like a fear of a witch.
Well, let me ask you about that too.
We don't want sick people to get this witch.
Right. Well, and they're having shortages with medications and stuff like that. Somebody told me the other day to go on the FDA site. Under Dilaudid, it says now, I think it was discontinued. What does that mean? I mean, it stopped?
Well, the great paranoid of American history was Richard Nixon.
Mm-hmm.
The man was truly mentally ill. He tried to kill. Well, he did kill the peace conferences in Vietnam before he even became president. The war dragged on for another 7 years. He thought everybody was his enemy, so he makes this law in 1970 called the Controlled Substance Act, because he thought if he controlled drugs, he could control all these commies and hippies and black folks. I mean, that's how sick he was.
Wow.
So they write this law that allows the federal drug police to be in charge of the manufacturing of pain medicine. So the DEA thinks that, hey, why don't we just stop? We'll just make alcohol illegal, and that'll solve the problem. Well, that sort of failed. So now they're trying the same thing with drugs. They think if they cut back on the manufacturing of pain medicine that affects everybody in the United States, they're going to somehow take care of the overdose and addiction problem. This is really, medieval times thinking. Throw them in the water. If they float, they're a liar. It's kind of the same thing. Shrink the supply. Do you think that people with addiction disease are going to, oh, no more drugs, too bad, I'll just go get a job as a car salesman now, I'm fine.
Right.
It's absurd that they would think that. So now hospitals don't have any pain medicine. Pretty soon the pharmacies are all telling people to come back in a week. I don't know if that's just a ploy or they really are having shortages. The federal drug police control the manufacturing of prescription pain medicine. And you see, these are the things that Congress needs to look into. Should they really have this power? I mean, this is something that needs to be done at FDA or National Institutes of Health, not the communicable disease doctors.
Right.
We've really gone off the tracks, and Congress is the way to fix things.
Okay. Well, another thought is like, what if there was some major disaster somewhere and we needed all this? We wouldn't have it then. So how did they let it get to this point? Because I know that they have shortages of medications, all the time. But is it just is it out and in being written about more lately, or is it the same as it always been?
No, there's so much written, there's so many blogs and websites and stuff nobody knows. Mm-hmm. But what struck me about visiting people and senators in D.C., we didn't know this was going on. Mm-hmm. Thank you for telling us.
Right.
If nobody tells them, nobody's going to know. They're not going to read all these weird blogs and stuff that are making these reports. They need to know. They need to be told. And you can talk to the staff. You can send emails. It's always better to visit regional offices. Just call them up. That's what they want. They want to talk to people. Don't be shy. Just go in there and say, what's going on? How come the federal drug police is shrinking the supply of pain medicine in the hospital? How come the CDC, the infectious disease people, interfering with my doctor, making him afraid to prescribe? It's the constituents that are key. Mm-hmm. We doctors can go in and complain too, but we're just seen as another constituent. So, in other words, if a whole bunch of people that are having this problem can't find doctors, not getting medical care, being screwed for their painful disease and their rare disease, these are the people who are going to get the voices. So, rah, rah, hiss, boom, bah. We got to get out there, get into the legislators' offices, or talk to them on the phone, anything, communicate with them. Because then when the senator comes, he says, what's going on? Geez, we got 100 calls this week about doctors being interfered with by the federal government, and people thinking about committing suicide at hospitals running out of drugs. Oh, now they have the information. They're not clairvoyant. If we don't tell them, they're not going to read all these blogs. Right. You got to tell them face to face.
Okay. Well, we're going to wrap up here, but did you have any last words for the audience this evening?
Rah, rah, hiss, boom, bah. Get out there. You have a lot more power as patients in terms of Congress than I do.
Okay.
So, just do it.
Well, thank you so much, Dr. Kline, for joining us this evening, and we will see you next Tuesday.
Good night,
Good night. And Con Nation, I just want to remind you, tomorrow night at 8/7 Central, guest Victoria Swan will be with us talking about her full-length feature film called Becoming Incurable. It's about 3 different people with different rare and painful diseases and the difficult issues they face living with their disease. Thank you so much for joining us this evening, and we will see you tomorrow night.
You've been listening to The Doctor's Corner with Dr. Kline and Janelle Elgway. Copyright 2018 by EXG LLC. All rights reserved.